and 10 minutes for question answer. Namaste one and all. Dr. Shashikant here. So we'll start a presentation of the focus of our research, like how in my clinical practice and in my practice, how I use these modules in my day-to-day practice. We'll go to the second slide.
Yeah, this is your second slide. You want me to flip your slide? Next slide?
Yeah, next one, ma'am.
Okay. Yeah.
There was an interesting understanding and awareness when first time I met Dr. Nagaratna ji. She was MBBS MD of RCP, head of Arogyadhama Vyasa. She mentioned one point that why can't you think of joining MD? So I met her in Palace Grounds for a book exhibition. So then she mentioned you will be the first MBBS doctor to do the MD yoga from Vyasa if you do. So that was a very interesting point where I was interested in integrative medicine from the beginning time, and I was having some source to get involved into. So that was my initial motivation to join in for MD in yoga and rehabilitation. So during my studies of MBBS, I always used to be inspired by Swami Vivekananda and an Indian heritage. But I always used to think that we as a so-called modern medical doctors are following exact version of a British medical system. So British medical system, whatever they are saying, if one drug is released in UK or USA, for that drug to come to India, it will take some 20, 30 years minimum, at least 4 to 5 years, if in an emergency. So we are so much dependent on the Western medical fraternity, so much so that it has become like a subconscious slavery mindset. So this always used to hurt me all the time, and I used to think what we have as an adaptation for a Western conventional medical practice, what we have as an Indian. So answer used to be always yoga and Ayurveda and Indian spirituality. So this is kind of motivation for me to learn more about yoga and Ayurveda and the spiritual heritage of India. So that is one joining point for me to get involved into an integrative medicine through starting point of Vyasa. So Vivekananda ji always used to say the best, combine the best of the East and the best of the West. So always my mind used to, so being a medical MBBS medical doctor, if I talk about yoga or Ayurveda, the acceptance of Ayurveda and yoga will be a little better specialties, other kind of doctors. World Disease Burden WHO. So there is one interesting statistics I would like to share is NCDs, non-communicable diseases, constitutes about 41 million deaths every year, which constitutes approximately around 79 to 80% of all the deaths put together. So it is a statistical data which is very staggering. So it means non-communicable diseases are responsible for more than 80% of the deaths, and most of these are preventable. And another statistic says 70% of primary physicians visits. So USA-based statistics from NIH, National Institute of Health. 70% of the patients who visit the primary physician, the family doctor first time, all the 70% of the time, diseases are associated with stress. So it is a staggering statistical data saying that if we can avoid or reduce or mitigate or cope up with the stress, I can avoid 70% of the time to visit a modern medical doctor. And by seeing popularity of yoga, other conventional complementary alternative medical systems, top 10 used to be yoga and Ayurveda. So NIH has decided to have another unit called as NCCAM, National Council for Complementary and Alternative Medicine. So which has formed after seeing a tremendous growth of 39 to 42% of routine patients diverting towards one or other modalities of alternative treatment. So this has inspired to act upon the disease much before it starts. So it comes to integrative medicine, preventive medicine. But the preventive medical system is not evolved so much because of the financial matter where people do not want to pay for prevention of the disease. Once the disease comes, the doctor comes for action for giving treatment at the physical body, as Dr. Chow was telling. So we'll go to the next slide. Whatever is the cause of the disease, genetic, nature or infection or any other diseases, we got to know that 70 to 80% of the diseases are NCDs, non-communicable diseases. Amongst these NCDs, there are four major categories. First one is hypertension and cardiac-related deaths, the first major killer worldwide. Second one is cancer, varieties of cancers. Third one is COPD, chronic obstructive pulmonary diseases, all lungs-related obstructive diseases. Fourth one is diabetes. So if at all we focus on these four major categories of diseases, we can address around 80% of the premature deaths worldwide. These are all statistics from WHO. With this focus on working in integration with conventional medical practitioner, I associate with seniors like neurologists or general physicians or endocrinologists, and I work with them to design different modules. Madam, if possible, we'll go to the next slide. So next slide is a illness wellness continuum. This one slide will explain the best integration of and complementary the merging point of the conventional continuum. At the center, there is a neutral point. Towards the left side of the illness wellness continuum, there is a disease progression. Early stage of disease, medial stage of disease, advanced stage of disease, and at last is a premature death or death. And towards the right side, it is a optimal health and wellness. So
Excuse me.
doctor focus.
Sir, slides are not moving.
I need madam's help. Second one.
So wait, it was on the second slide only. I'll again share your slide.
Okay. So that's okay. So illness wellness continuum. On left side, there is a progression of disease and premature death. On the central point is a neutral point, and towards right side is an optimal health and wellness. So any disease a doctor is seeing, he is seeing from the neutral point towards the left side. Our aim of our work of integrative medicine and designing module is to bring any patient from the stage 3 towards 2, towards 1, and towards the neutrality. And then the maintaining of good health. Swasthya Rakshanam, what is our Ayurveda principle says. So treat the symptoms, maintain the health. There are only two main aims of Ayurveda. So then the incorporation of all the integrative modalities start from here towards the maintenance of optimal health or wellness. In this regard, for Western audience to get convinced, I use a module of S art. Yeah. So this second slide you are seeing as a it's an illness wellness continuum, and illness wellness continuum suggests that high level of wellness can be achieved through awareness, education, and growth. What LYBL is trying to do is to add this awareness, education, and growth in the form of online presence of various videos and all different subject matter experts, diet, Ayurveda, and yoga. So I use the modality of S art. So S art represents the self-awareness, self-regulation, and self-transcendence mode. I'll share it in the S art module. Awareness, self-regulation, and self-transcendence module, which means that if we can use yoga as a YBF, yoga-based practices, all the Western audience understand YBP. They all call it as YBP. So if at all I have to reach to their minds and hearts or their left brain orientation, I go through this. So all the yoga-based modules, if we know from the past research articles and the incidences of yoga practices, 20 million, on an average 20 million Americans practices yoga every day. So this is again a very interesting statistical data for me. And I used to focus on I wanted to focus on a new place where there is a less of yoga. So statistics has helped me to take the shape of my work in my life career for all these 14 years. So once I got to know that 20 million Americans were practicing yoga, and I wanted to find a new place where there is a less of a religion, more of the challenges. So I focused on China. So presently, usually when we get the statistics, we get the statistics from the known world, like America, 20 million people. But actual statistics now says that there are more than 30 million yoga practitioners are in China. So yoga came to China around 2002 when through America. So this is very interesting statistics for me. And with this little basic statistics, I focused my journey towards China, where I combined the different modules and I projected myself as a cult. We'll go to the next slide, which will be the last. So this is based on 44 research articles combined together, which suggests that yoga module. I'll include both my individual growth and the content for LYBL. So appropriate and robust protocol for better, efficient trials in yoga can be put together in these few highlighting points. First one is a style of yoga. So world knows, Western audience knows as a father of modern yoga is Krishnamacharya and the lineage. All those three major subdivisions of Krishnamacharya Yoga School: Iyengar School of B.K. Iyengar, Ashtanga Yoga of Pattabhi Jois, and Desikachar of Vinyasa Yoga, Chennai, Mysore, and Pune. These three are major subdivisions of Krishnamacharya Yoga, modern yoga style. So West only understands this. West do not know much of the deeper aspects of what we are discussing. Right now, we are discussing with the acceptance mindset that we all know the Panchakosha Viveka, we all know the Vata Pitta Kapha, we all know the Panchamahabhutas. We are accepting subconsciously. Once we are accepting subconsciously, then we are talking about how to integrate Vata Shamana Yoga, Vata increasing yoga, Pitta Shamana Yoga. We are discussing this discussion is happening because subconsciously we accepted the principle of the yoga and Ayurveda philosophies. But West is not that. West only knows from the perspective of what it has been exposed to. It has been exposed to these three styles of yoga. They know the structural yoga is a subdivision of B.K. Iyengar student who started a structural yoga. So there are n number of yoga institutions. Somebody says there are as many number of individuals, that many yoga institutions can be named. And one difficulty for modern research orientation, I'll give all the few relevant examples, is in drug trials, in clinical formulations, in the yoga style, everywhere people wants to project their individual brand or individual medicine and then trademark it. For example, I'll take a yoga module. Sahaja Yoga is a practice based on the Kundalini style, which is again the basic platform is Patanjali and Hatha Yoga. Combination of this only. It's an offshoot of that. Derivation is from that. And there are n number of articles you'll find in Sahaja Yoga. Similarly, Sudarshana Kriya, famous. There are research articles published from Nimhan. But basically, Sudarshana Kriya is a trademark content which under signed trademark content which has a Ujjaya Pranayama, Vibhagiya Pranayama, and hyperventilation techniques, which are modulated in a nutshell in the form of a trademark content of Sudarshana Kriya. So likewise, in USA, curcumin, as an example, curcumin, ashwagandha are used as a single drug medicines. So there are a lot of funding for doing the trademarked content rather than the general, like Nadi Shodhana Pranayama helps for hemispherical synchronization. So this is a generally known research article. There will not be much funding for, if we at all want to take up any yoga modules, there will not be funding for generalized yoga. But if you say, I want to have an trademarked LYBL yoga module, then there will be a lot of funding. So this is a highlighting point for us to think in this direction of making yoga-based practice modules, which are focusing completely on optimizing the health, promoting the stress reduction, and increasing the self-regulation in the perspective of preventive and therapeutic modalities. So after this statement, there are various styles of yoga, and yoga being the non-licensed modality in the West. So it is just taken as a, you can think like a with a big meal you are taking pickle. So similarly, yoga is taken. Yoga do not have a structured license approach. There is a Yoga Alliance certification 200 or 500 hours and all those. Are again on education, just 2 months of study of yoga, you will become yoga master. 500 hours, you will become yoga master without them teaching asana. The West is physical and psychological benefits. So, but for us, yoga is a complete package. So, if we can make a package of a style of yoga, again coming back to the first statement, is style of yoga. You make your style. Are you focusing on the structure, alignment of the asanas? Are you focusing on the breathing techniques? Are you focusing on the mindfulness component of the meditation, and doing some modifications which are allowed, which are which will not cause any copyright infringement, and then give a modified version of practice. For example, in a breathing, I can add an example that a paced breathing technique will increase the prolactin levels and oxytocin release, which can promote the feeling of calmness and social bonding. So, this is a research article from Dr. Turner et al. 2002. So, if we have a clarity of what to give, we can design a module accordingly. So, with a simple statement of this paced breathing increases prolactin and oxytocin, with another understanding of inhalation coincides with the sympathetic nervous system, exhalation coincides with parasympathetic nervous system. If I can design, so I use a module called as 4-4-6 breathing, 4-4-8 breathing. So scientifically, I know that inhalation coincides with sympathetic nervous system, exhalation coincides with parasympathetic nervous system. I design a breathing technique saying that 4 seconds breathing, 4 seconds holding the breath, and 8 seconds exhalation or 6 seconds exhalation will stimulate the parasympathetic nervous system. That is a kind of hypothetical claim based on the previous research article. If I design, so I design a module of 4-4-6 breathing with a mudra. I individually use this as a mudra. Mudra, I use it as a thought dissociation technique. So I'm giving a breathing technique. Nadi Shodhana I can use, no doubt. Left nostril breathing I can use for reducing the sympathetic dominance I use. But also I can give an additional trademarked content which I claim, quote unquote, I claim that there is a difference between generic yoga and non-generic yoga. I can claim that it will have effect on your perceived stress scale, PSS. Yoga can reduce the stress by changing the galvanic skin resistance and indirectly reducing the sympathetic tone. If you can prove, because we know the science behind yoga, we know the basic research literature review, and if we can propose this, so what I propose right now is style of yoga. I'm giving a breathing module of 4 seconds, 4 seconds inhalation, 4 seconds holding the breath, 8 seconds exhalation as a breathing module with a mudra. For each disease, I can add a mudra. Mudra will help me to dissociate thoughts from worrisome thoughts to something neutral. You can claim that number of thoughts will be reduced, sympathetic tone will be reduced, and we'll go to a phase of relaxation response. So what Sunita madam was describing, release of endothelial nitric oxide. This is the greatest ever research. We should never forget Dr. Herbert Benson, who recently in February passed away, 2021, was the greatest scientist who worked on the relaxation response. I recommend this book to all of us, all the LYBL friends. None of the modern medical doctors would be ever aware of this book. We revere the Harvard Medical Science, we revere all the great institutions, but we do not know it. So the limitations, we're not being exposed, including being in India. So there is a pathetic state of that's okay. That's not there is a significant transformation in the education system. So coming back, French style, particular style, because there is a gray area. There is a huge gray area. There is no exact modules which have significant, individual modules designed for a particular cause. There is not much. Going to the next, dose and delivery of yoga. So up till now, on an average, people have used weekly 2 to 3 classes, each from 45 minutes to 60 minutes for 6 to 8 weeks. This is on an average of all these 44 articles. On an average, it says that we use only 45 minutes to 60 minutes module, which is subdivided into breathing technique for 5 minutes, asana for 12 minutes, meditation for 8 to 10 minutes, and the explanation of related this particular practice for 2 to 5 minutes. It encompasses around 45 plus minutes. So longest one was one which was done on the back pain. It was the longest module which was for 12 weeks plus. So dose and delivery of yoga, it is again another second important part, that if we can modulate the dose according to the dignitaries, whatever we have, all these people, they're all more than enough for us to design a particular dose and delivery of yoga system by various permutation combinations with all the discussions. If we can design and make a ready presentation, it will be appropriate for us for a best yoga protocol. So that gray area where there is a protocol is missing. Individual techniques are there, like I mentioned, Sahaja Yoga. Individual techniques are there. Left nostril breathing, right nostril breathing, Chandra Bheda, Surya Bheda, Nadi Shodhana Pranayama. So West has a little different mindset with, I don't know why they hate Eastern mind body medicine, that is yoga. I don't know why West hates. So Nadi Shodhana Pranayama, they want to call it as a coherent breathing technique. So there are research which will change the perspective of yoga altogether. So I don't know, it is an inferiority complex or what, we exactly do not know, but they claim convincing the Western mind is little difficult. They do not understand the art and the intuitiveness of Ayurveda principle. They do not understand the art and the depth of pranayama, when Manjunathji was telling. So being established in the prana is different, which I can categorically tell them that if I can design a swastika in the line diagram, at the center, I'll make 3 circles. One circle at the center, around that circle, another circle, around that another circle with 5 spokes. So center circle represents the spirit, the surrounding circle represents the mind, and surrounding circle, another circle around it will represent the body, and the 5 spokes, 5 arrows represent 5 senses. So if you are established in your true self, it means the mind, body, spirit is aligned. Your parasympathetic, sympathetic nervous system is balanced. Your muscles are toned better. Your regulatory system is better. Your acid-base balance is better, and you're contented within. Then only we can say swastika. So with this, understanding of the Eastern science, even WHO has to change the definition of health. So they will not. So we need to have a robust dose and delivery of yoga. And next one is the components of yoga intervention. What exact components we add in the yoga intervention? With this 44 articles, what it says is majority of the yoga inclination is based on selected asanas given for the particular duration. Like one asana you select and give for 2 minutes, holding asana or a flow of asana. Then you add other asanas and give particular permutation combinations, add a breathing technique, add a relaxation technique. Majority people uses relaxation technique. I'll give 2 examples. Mindfulness based stress reduction, MBSR program, designed by Kobat and Zinn, 1990. Mindfulness based cognitive therapy program. This is designed by Siegel et al. 2002. So West understands, if I say anything like this, Western people's mind, including people, all doctors from India, I'm talking about conventional doctors, they'll understand, kuch to hai, they'll say that. But if I say, I'll give a definition, or just if I express the mindfulness, I'll express the mindfulness as the awareness that emerges through paying attention on a purpose in the present moment and non-judgmentally in that present moment, you unfold the experience moment to moment. So looks complicated. So if I make this a research article, so Kobat and Zink. So another definition, if I say the discriminative awareness of encoding, registering the experience, considerably associated with ethically developed as a path towards the enlightenment and cessation of suffering. So this is another definition for mindfulness. If I give the Western audience like this with a reference, they will adopt any of our module which have our components with the sync with complete modern perspective. It is uh, not just a bias, or it is not just my own individual experience, but it is a collective experience. So we have to design a components uh, which have components of same Nadi Sadhana Pranayama, same left nostril breathing. I can give in 20 different modules. As Dr. Cho was also saying, left nostril breathing 27 times. It is reductionist mind, where half of that is 54, half of that is 27. So there is a spiritual component in the number breathing. For general anxiety disorder, if I use 40, 40, 40, yes, you can use a module. You can claim that your cognitive functioning and emotional processing will change based on the changes happening in the prefrontal, parietal, cerebellar circuits of the brain, based on the research of Balster et al. 2014. If I say this statement, even though it is a research-based statement, yet I modify 27, 27, 27 left nostril breathing. I'll add it as 40, 40, 40. If it is 40, 45 times, I work in the neurology department. I designed modules for, so we have seen significantly quality of life index. There is a number of, I'll ask them to maintain a stress diary, saying that note down the episode, what is happening to you, and how you respond to the incidence of stress, and how you better respond. So that itself is I'll ask them to do a column saying that one is date, second one is incidents, stressful incidents, whatever stressful incidents happened with them. Next column will be the immediate response. They cried, they fight, whatever. Next to that would be another column which says what is better response according to you. Just noting down subconsciously this cognitive behavioral therapy. So in this assertive, this is done in Vikram Hospital. What I mean to say is what components you use, if it is a filtered out component, then the acceptance of world will be much better. Then coming to the specific class sequences. As we know, we studied from various institutions, Esrasa, B.K. Iyengar, Patanjali, Bihar School of Yoga, and all these major institutions. Each person's style and focus would be different. So if I break it down, asana, same asana, if I do it slowly with awareness, there is a change in the thermodynamics of the blood. If that can be noted down, there is a student of B.K. Iyengar who was a cardiologist. He used to record ultrasound of blood circulation of different people doing different asanas. Ardha Shirshasana, Shirshasana, Bhujangasana, no dog. Every asana, he will just do the scanning, jugular veins, stroke volume, how the heart pumping capacity, specific, well-designed, trademarkable content for LYBL. We have to be absolutely specific. Again, this specificity comes from various input from all of you. And fifth component is dealing with modifications. When I'm telling, research says that so yoga increases GMV. Yoga increases gray matter volume. There is a research which was done for more than 4 or 5 years, and they found all the yoga instructors. They found that the particular area of the brain, insula, cingulate cortex, medial prefrontal cortex, inferior and superior parietal lobules, have significantly increased in their gray matter in the people who are doing yoga, long-term yoga practitioners. Another research says long-term yoga practitioners deep sleep cycle will be better. Another research says long-term yoga practitioners GABA levels will be better, gamma aminobenzoic acid. Another research says the pain perception of yoga people will not be, they can tolerate pain better because they worked on the pain perception receptors based on the neuroimaging called as the voxel based morphometry and the diffusion tensor imaging. So they noticed that pain perception was much better, emotional contentment was better based on the prolactin and oxytocin. Because of this, interpersonal and intrapersonal intelligence was better in yoga people compared to normal people. Social bonding is better with yoga people because of oxytocin, example. So if you can modify something for LYBL and select, the next comes the instructor. This is the greatest ever bias in selecting a module, because there is no fixed module. Each yoga teacher, based on the basic knowledge of that yoga teacher, content will become changed. Yesterday I was mentioning slow Surya Namaskara, fast Surya Namaskara. This is the Dr. Ananda Balayogi's research. He concludes that fast Surya Namaskara, I can use it for weight reduction module. Slow Surya Namaskara, I can use for hypertension module. So we need to be so much precise. Why are you using slow Surya Namaskara? Why are you using Chandra Namaskara? Why are you making particular asana hold for certain duration? Then it will become an isometric. So if I can subdivide 650 skeletal muscles, 230 joints, and 206 bones in permutation combination, yoga is the only exercise in the world which will work on the skeletal muscles, the smooth muscles, and the cardiac muscles. This is absolutely staggering. It is like a wonder. There is no exercise in the world which can work on the smooth muscles of your esophagus and the stomach. So the kriyas, where we are not going to give any kriyas to online public, I understand, but when we explain, yoga works at all these three levels. When you're doing the kumbhaka, there is a change in the diastolic blood volume. If I know, if I can design something for person with congestive cardiac failure for retention of breath, kumbhaka, I modulate. I will not say Hatha Yoga says karo. I will not say that. I'll say research has done, and it shows that diastolic blood volume increases. Diastolic blood volume increases, your cardiac load reduces. Allostatic load. Cardiac load reduces, the perfusion to the coronary artery will be better. So this is a 5-year study from Narayana Hospital, Narayana Hridayalaya, post CABG and yoga. There are a lot of PhD, MSc students are involved in this. So it says that just like how calcium channel blockers will work, yoga also works as an adjunct. They use it as an adjunct. So selection of the instructor is at most important. Manjunath ji was telling, nowadays anybody with 2 months, 3 months yoga teaching will become yoga master. There are so many institutions now offer, you sit at home, pay me 1.5 lakhs, I'll give you PhD. I can introduce. So in this kind of clouded Kashmala filled environment, we need to be a pure potential where select the instructor, whoever done MSc, PhD, whatever, authentically. Select them with a knowledge base that can be selected by our own team. Whatever team we have now, it's best, I think, because it connects with the best of philosophies much meticulously. So selection instructor, if it is a good knowledgeable instructor, he or she can deliver much better. So next comes is a facilitation of home-based practice. So this we should be careful in designing, as Medha madam says, level 1, level 2, level 3, level 4. We have to design the module in such a way that it will make people follow in a uh, larger amount. Larger subscribers should be more, and they should follow it. Follow our practices better. So module should be better, and measurement of intervention over time. So because it is a online module, we need to be precise in what we might get. Yesterday I was mentioning like a physical parameters, blood parameters, or a psychological questionnaire based parameters, or any other variables if you are using. We need to monitor 1 month, 3 months, 6 months, 1 year, depends on the number of duration of subscribers and their their intervention. If it is 6 weeks, 8 weeks, 12 weeks, whatever it is, and we even if we get 30 people's proper data, we can publish good article, good research article. So this was in a kind of nutshell, which is what should be the appropriate robust protocol for us. So we'll go to the next slide. So challenge for us is I reduced all the slides because most of slides were it is overlapping. Sunita madam's, Manjunath sir and Chob has most of the slides we were already know. A bunch of 5 sheets and all those adrenal axis, biological clock, circadian rhythm, serotonin, all happy hormones and everything. If we go one more step deeper, for example, if I'll give one example. If we're doing Trataka, a yoga teacher is teaching only Trataka. Okay, Trataka famous one is the candle gazing technique. You do the candle gazing technique, you learn Trataka, all the basic things. If I can connect to a Western audience saying that, okay, if he or she is an ophthalmologist also, if sitting there, I can say that, sir, when there is an ocular convergence, there is a defocusing effect on the brain. How can you say that? If he or she asks, I'll say that there is already research done by BAHM, 1965, has done a research on ocular convergence and defocusing. Same defocusing effect, yoga people are telling it like a Bhrumadhya focus. You focus on your Bhrumadhya, the place, we call it as medically, we call it as glabella, the place between the eyeballs. You focus on the glabella, you feel the defocusing effect. Another research says that when the mind is wandering, there is a small circular, micro movements of the eyeballs along with the mind. So if eyes are fixed onto a point, there is an indirect effect on the mind to control it. So this is proven with the research that if the external, the eyeballs will develop at an age of 2 weeks after the conception as a direct extension of the brain. So brain, direct extension, ocular eyeballs, and more than 80% of the external world stimuli is from eyeballs and the inner ear. So if at all I can design a yoga module, and I'll say that in Trataka, if I say Trataka, I'll give it as any yoga teacher. Then I'll say that when you fix your eyeball, there is computer vision computer. I claim that the blink rate, normal blink rate is 14 to 20. I'll say that blink rate is blinks per minute. Then introduce yoga module, which again based on ocular convergence and defocusing effect and indirect effect on control of the mind. Then I'll give a designer module. Then post after they do it for 4 weeks, 8 weeks, 10 weeks. Then I'll again measure the blink rate. If there is a p-value says that blink rate is enhanced when the practitioners of computer vision, people with computer vision syndrome, or IT people focus on IT, then this itself is a module which is based on one research, the ocular convergence, second Eastern philosophy of Trataka. So if this is exactly what I'm trying to say is this is already it's a module. So if I can create a module like this, which is altogether new, which combination would be never heard of. Same modules I can add. Okay, focus, defocus, eyeball exercise, the palming effect, and all those, but make it in a particular masala that the West audience understand the masala. Like I can say that there is a research by Craig 2009 states that insula is a part of the key neural substrate which focuses on interoceptive awareness. When you're doing yoga, particularly yoga meditation, if I do, I'll say that check your functional brain MRI. What is the state of insular cortex or primary secondary sensory motor cortices or anterior pre-curious? All these nuclei, is there any change in the structural change in the gray matter of functional brain MRI if we do by our meditation? So if I give them so much precise, they will show the interest. If it disproves secondary, if they prove, okay, sir, your technique is not working on insula. If they say that, for us, it is a good that we know that it is not working in that particular part. So we might not help them in, getting a cognitive therapy for emotional balance, cognitive balance, memory enhancement. So we'll change and we'll see the other modalities if we can give. So coming back to a statement that LYBL has to focus on trademarking their content, filter out all the baseline, everything, all the efforts should be focusing on what breathing technique, what asanas from the scriptures of traditional Patanjali yoga style or Hatha yoga style. Hatha yoga describes about 15 basic asanas. Giranda Samhita describes about 32 basic asanas. But altogether asanas, there are 84 lakhs of asanas. Amongst that, like as many number of yonis, that many asanas. One of the book describes. And then Lord Shiva describes that amongst these many asanas, 84 asanas are important. And filtering out 84 asanas, we'll say 32 are most important as represented by Giranda Samhita. So if we design a yoga module basically using these 15 asanas from Hatha Yoga and 32 asanas from Giranda Samhita, there is a primary components of the previous slide, what we designed yoga module components of that, which you will get a scriptural reference, anatomy, physiology already available, research modalities, we can connect to it and add our hypothesis. When you add your hypothesis, it is a difficult part because it's not easy question for us. We have to prove it. In that proving part, LYBL can think of investing money, all the research articles, because they are going to get. So with this, I think I'll pause and I end my presentation that it is a wide open for debate and discussion, because it is a part of experiential and part of intuitive expression of PowerPoints. I was not very good in putting them everything in a kind of a slides. I was thinking it PowerPoint. Usually it will overwhelm us to read the presentation. I'll become very sensitive to read the presentation. I'll not be able to express. So I made it very just 4-slide presentation. Coming back at the last point is we have to design a module which are called as YBP, yoga based practices, which West understands, and with that whatever components what we shared, what we we can use like different interventions like multidimensional assessment of interoceptive awareness, MAIA. So difficulties in emotional regulation scale, DERS, rational compassion scale, RCS, body awareness questionnaire. Like this, we can add multiple perceived stress scale, subjective well-being inventory. So all this, there are as many questionnaires we can add, which are already available, and physical parameters which are very precise. Rather than just we're saying general statement, your lactate, your salivary cortisol will reduce. So we need to test and prove it. It's very simple. If biochemistry can help us in getting that done. So design our own module based on the existing literature review of different modalities, and then claim that it is working in a particular way and try to prove it. So that's the way I think, as an individual, I think of setting a standard, because there is a good gray area uh, in the yoga protocol design, because there are not much specific targeted designs which are proven. So with this, I'll end the session, and it is never ending session, but I'll give a pause to my mortal space dimension, but it is wide open. We can work on many generation on this.
Shall I stop sharing the screen, Dr. Shashikant?
Yeah. Yes, madam. Yes. Thank you, ma'am.
Thank you, Dr. Shashikant, for taking us the factual presentation, facts of the research in yoga field, and identifying the gray areas in the research models. If anyone wants to have any questions or any inputs or any discussion points, you all are welcome. Session is open for the discussion and the question answer. Hello. Hello. Medha madam, any inputs from your side? Am I audible? Hello.
Yes, madam, you are audible.
Yeah, you are audible, Dr.
Yeah. So any inputs, all your suggestions, inputs, or any points which you want to convey, all are welcome. They give us a guideline.
Namaste.
Rajesh.
Shashikant. Namaste. Am I audible?
Yes, sir.
Yes, sir.
Yes.
You are audible.
Yes, very nice. Though I could listen to some of your talks, this is amazing connectivity. That's what I feel. How do we connect this? Connecting is the most important part of that, and connecting to the Western world, this Eastern science, there are some innovations, definitely. As Shashikant ji said, that they know only three, either the divisions of yoga, like Krishnamachari, V.V.K. Iyengar, B.K. Iyengar, and Pattabhi Jois Yoga, Ashtavinga Vinyasa Yoga. But they don't know, they don't even accept. This is the truth is, even when I went to China, they are not ready to accept beyond the body level. This is what is bothering. If we say something spiritual, they say, no, we don't want. We are happy with the body level benefits and all. They say they don't want to go beyond the body level. So this is what I experienced difficulty when I tried to give the insight from the spiritual angle in China itself. So I was not aware of this. In 2002 only China started doing yoga. So before that, even I'm surprised to hear first time from Shashikant ji. So I was not knowing that, but this is what we connect. Connecting is the most important aspect. What we have to do it in a very intelligent way. For doing all this, intelligent people, all of us are intelligent here. But connecting all the intelligence and presenting in a palatable way, that's what matters. And the liable model, everything modules, we have to together sit and modulate all these things, taking everything. Right? Very nice, Shashikant ji. Thank you very much for your input.
Thank you. Thank you. Thank you.
Any other? All are welcome. I think we are all can talk. Dr. Gunjan, Dr. Sangeeta, Medha ma'am. Okay. I think no, now there are no comments or any discussion as such. So we will conclude the session. Thank you, Dr. Shashikanji, for giving this inputs and recognizing the gray area.
Thank you, ma'am. Thank you.
Yes.
Thank you for helping me.
Thank you, everyone.
Thank you.
We'll
Thank you,
conclude
Ananda.
this meeting. See you, everyone.
Thank you.
Bye.
Thank you, everyone.
Thank you all. Thank you, everyone. Namaste.